Once again, I'm happy to welcome you all. And the topic is oral diseases and care. This is the second in our online lecture series. And I hope you will understand what is meant by oral diseases and care. If you listen enough, I'm sure you will gain from this lecture. This is part of your studies as community health practitioner in the making. And it's very important you understand this. You don't graduate without understanding what oral diseases are. If you get to a community where you need to attend to oral problem, you should not be a novice. That is why this lecture is important for you. I said there are learning objectives. At the end of this lecture, you'll be able to define what oral health care is, identify oral health diseases, oral diseases rather, identify different manifestations. That is different manifestation as in when you open the mouth of a patient, what do you see there and what does it imply to you? Identify oral landmarks. What are the different features in the mouth of a human being, your patient? What are the landmarks? How do you identify them? How do you know it is healthy or it's not healthy? You also know the parts of a tooth. A tooth is not just how many they are. They have different parts, they have different names. You'll be able to identify them. Now, the teeth in our mouth erupt at different times. We have the deciduous teeth, which is called milk teeth. Then we have the permanent teeth. I will show you how and at what age we all grow different types of teeth. Then you will be able to describe consequences of dental problems. These are what you will at least be able to go out with at the end of this lecture. Then when we talk of oral health, we're talking of human mouth. The human mouth is the main thing when we're talking about oral health. And it consists of the mucosa. The soft part of the mouth is the mucosa. It consists of the lips, the teeth, and the floor of the mouth. And our mouth is usually meant for two purposes: to receive food and drinks and to communicate. I'm able to communicate with you in this lecture because I have a mouth. I'm able to stay before you now because I probably have eaten. So the mouth receives food and drinks and is the gateway to the alimentary canal. So many of you who are students of biology, you know what is meant by alimentary canal. That is the gut, where the food passes to the stomach, the digestive system. And again, you know, the mouth consists of mucous membrane. There's an epithelium layer, the lining. And this leads to the digestive system where digestion takes place. The mouth produces saliva. That saliva contains some enzymes. And these enzymes begin the digestion of at least carbohydrates. So for communication, the mouth is used for communication, as I said. For you to be able to communicate, the lips should be there, the tongue should be there, the jaw should be there. Sorry, not just the jaw that should be there, the lips should be there. And the teeth should be there too. Because if the anterior teeth, that is the teeth you can see in front, are missing, I'm telling you, the individual will find it difficult to communicate, will find it difficult to speak. So the lips and the teeth play an important role in phonetics, in our communication. Very important that we take note of that. So the human mouth is to receive food and for communication, and consists of lips, mucosa, teeth, and the floor of the mouth. What is oral health? I think it's important we know this. What is oral health? Oral health, according to World Health Organization, it encompasses, that is oral health disease, rather. It encompasses a range of diseases and conditions that include dental caries, periodontal disease, tooth loss, oral cancer, oral manifestation of HIV, orodental trauma, NOMA. NOMA is otherwise known as cancrum oris. It's a life-threatening disease that can disfigure the mouth. And birth defects such as cleft palate and cleft lip. These are, according to our World Health Organization, different diseases that the oral health is associated with. So, and in 2017 rather, WHO did a study and said 3.5 billion people worldwide have untreated dental caries. That is to tell you that there are a lot of cases in the hand of a professional who deals with oral health. We know the total number of people on earth, according to statistics, is about 7 million. So we have, according to WHO, half of that people having oral diseases, untreated oral diseases. You can agree with me that that is a lot. That is very, very huge. That is very, very huge. So anyone that is dealing with oral health, no doubt, has a lot at hand. So oral health consists, like I said, dental caries, periodontal diseases, and so on and so forth, as identified by World Health Organization. This is our mouth. This is how our mouth looks like. And then if you open your mouth, you will see the following. First, you see the lip, the gum, that is the soft part of the mouth. You see what they call frenum. Sorry. You see the frenum. The frenum connects the inner part of the lip with the gum. You see the uvula. If you open your mouth, the uvula is that projection at the point of the throat. If you open your mouth, you can see. Some people you can easily see. You see the tongue. Then the lingual frenum. The lingual frenum is right there around the tongue area. Then of course you have the teeth. The teeth is the most prominent that populated the mouth mostly. Then you have the submandibular duct opening. That is where saliva comes out from. If you raise your tongue up, you'll be able to see it. Of course, you see the lower lip. Just follow my pointer and see which one I'm talking about per time. You see the inferior labial frenum. The labial frenum is in front, the front of the mouth. Then you have the buccal mucosa. The mucosa is nearest, the area nearest the cheek. You have the soft palate. If you touch the floor of your upper jaw, if you're going towards the throat area, that is where you have the soft palate. The soft palate, if you touch it, you throw off. So it's not a place that hand often touch. And it's not a place dental appliance gets to. So that is the mouth of a human being for you, with all the teeth as they are arranged. So when you open your mouth, this is what you will see. Or somebody, you will see through a mirror, or somebody will see. That is how the mouth looks like. This is showing you the teeth also. This is showing you the teeth, different types of teeth, and different years of eruption. You see the anterior there, anterior teeth, the two of them is called central incisors. Now I'm dealing with permanent dentition, not mid teeth. So we have central incisors. And everyone grows central incisor between 7 to 8 years of age. That is permanent teeth. Then we have the one they call cuspid. Sorry, we have lateral incisor. The lateral incisor is the nearest to the central incisor. And between the age of 8 and 9, we grow lateral incisor. Then we have the cuspid. The cuspid is called canine. The canine, between the age of 11 and 12 years, you grow canine. Then we have first premolar, or it's called biscopid, because it's having two cups. So between the age of 10 and 11, you grow premolar, second premolar. A first and second premolar between 10 and 12 years of age. Then we have the first molar. That is why a child may not be able to eat solid food conveniently between this age of 7 and 10. May not be able to eat comfortably solid food. Now, the first molar grows 6 to 7 years. 6 to 7 years, it will be growing almost at the same time with the anterior. So even though it's not advisable for children to eat solid food, but then, no doubt, at the age of 7, that is a lot of age, and the child is no longer a child that cannot eat solid food. It's a mistake to have said so previously. Now, then we have the third molar. This third molar does not grow so fast like that. I can tell you as a matter of fact that some people, it gets up to 22, 23 before it comes out. And it used to cause pains and inconveniences. So as a matter of fact, when someone is a teenager, he mostly may not experience or may not know that he has not grown all his teeth until suddenly one day at the last molar, when the last molar want to come out, which is otherwise called wisdom teeth, you see pain, inconveniences. If some of you can remember, if you are past the age of 20 something, you can remember at the time you started having pains. At that time, that is the last molar, which is otherwise called wisdom teeth, are trying to come out. So, and if you look at the upper and lower teeth, you discover that the upper and lower teeth are usually bigger than upper teeth. They are usually bigger than the lower. That is when you look at the anterior. The anterior teeth of upper are usually bigger than that of the lower. But when you look at the posterior, in terms of sizes, they are more or less looking alike, except the first molar of lower, which usually have wider occlusal surface. So it's bigger than its counterpart in the upper arch. So the upper is called the maxillary arch, while the lower is called the mandibular arch. So upper maxillary, lower mandibular. So the upper and lower together, when they close, we have what you call occlusion. And once they are in working relationship, we call it that is a dynamic occlusion. And in dynamic occlusion, you chew, you move your mouth, you do a lot of things. That is about teeth in the mouth. Different types, the anterior, the posterior teeth. They are majorly categorized into two. The posterior teeth, they are from canine to canine, whereas the posterior teeth are from first premolar to the last molar. In dentistry, we don't replace the last molar, which is the third molar, otherwise called wisdom teeth. If anybody has lost all his teeth, when we are replacing, we don't replace 32. We rather replace 28. That is about replacement of teeth. We move now. If you look at teeth, you look at different types of teeth. Different types of teeth. You know, before we talk of incisors, then we talk of premolars, we talk of molars. These are the three categories that teeth are divided to. Now, let me talk about their internal structure. let me look at the molar. The molar is divided into three parts: the crown, the neck, and the root. The crown, the neck, and the root. These are the three major parts that every tooth is divided. Then the topmost is called the enamel, topmost layer of a tooth. If you give it longitudinal section, that is, if you cut it into two, you see the enamel, that is the hardest part. You have the dentin, very sensitive area of the tooth. Then we have the pulp cavity. The pulp cavity is where the life of a tooth lies. That is where the life of a tooth lies. That is where you see blood supplies. That is where arteries, the capillaries, the blood flow take place, the pulp cavity. If bacteria enters into this place, it has damaged that tooth, no doubt. Okay, and it may be difficult to treat. Then the root canal, that is where the pulp, the channel through which the capillaries supply nutrient to the teeth and supply blood as well. Then around that, the tooth structure, we have the gum tissue. The gum tissue is what all of you can see. The cementum, the gum tissue covers the cementum. Then the nerve and blood vessels, like I told you, we supply the pulp cavity. They all start from here. And then you have the bone, the alveolar bone. The alveolar bone is where a tooth grow up from. So the alveolar bone is what sustains the tooth in the mouth. So again, crown, neck, root are different parts, the three major parts to which a tooth is divided. And then I didn't mention enamel, the topmost layer, hard, that's what you can see outside. You have the dentin, you can't see it, it's sensitive. If a tooth, you have a problem and get to the dentin, no doubt that tooth becomes so sensitive. And the clinic is the next place for such a person to come for help. Then we have the pulp cavity, which I said, that's where the capillaries, the nerves, the blood vessels, the food nutrient that sustain the tooth, that's where they flow through. The gum tissue, which you can see, the pink color usually. So we have some people who have dark color of gum. We have the cement, we have the nerve and blood vessel, we have the bone, where that is sustaining the tooth, the mouth. So that is the tooth, the anatomy of human tooth for you. Like I told you previously, we have incisors, we have premolars, then we have molars. These are the three categories that the human teeth, the permanent human teeth, can be divided into. Now let's move to the next slide. Sorry, there's a mix up there. Actually, I want to show you different problems that can occur in the mouth of a patient. We have the dental plaque. The dental plaque is like is a biofilm. That is, it covers the mouth and it looks like a milky color. It looks like a milky color, and bacteria hide there. When bacteria hide there, it begins to eat and eventually damage the teeth. We have the dental caries, which is usually caused by bacterial infections. An example of that is Streptococcus mutans. These are bacteria that cause demineralization of the enamel of a tooth, and eventually breaks down the teeth and it gets to the dentin. The dental caries is a very bad disease that can make an individual lose his teeth if it's not attended to. The tooth decay, when a tooth has caries, an ordinary person said it has decayed. So tooth decay, they are usually caused by bacteria, and they result in caries. Caries can create holes in your mouth, different holes. Of course, people lose teeth through them. And at the same time, you can also lose your teeth by trauma. Some people during an accident, during a fight, a scuffle, they lose their teeth. So apart from dental plaque, dental caries causing one to lose his teeth, injury or trauma can also make an individual to lose his teeth. Here we go to more problem that can occur in the mouth. There's what is called bruxism. Bruxism is when an individual continuously grinds his teeth, continuously grind it. They can grind from the top layer to the dentin, and it causes a lot of pain for the patient if it gets to that level. You see some people when they are sitting down calm or they are asleep, they grind their teeth, they gnash it together. As they continue to gnash it, the surface continue to wear. The hard part wears until it gets to the sensitive part. At that time, the man or the woman can run mad, because it's like somebody is grinding the surface of an open sore. So it's a difficult experience. Bruxism is when teeth come together and patient grind them. Then we have calcium as an important component of a healthy tooth. We have phosphorus as well. These are part of a healthy tooth. This is part that should not be missing. This is what our food should contain so that our teeth will remain healthy. Then, of course, calculus is a disease in the mouth. It's hard calcium-like deposit that is that cover the teeth, that can stain the teeth, that can cause the teeth to be lost. Again, let's look at another problem that used to occur to teeth. Periodontitis problem is an infection of the gum. Many of you may have experienced periodontitis problem where maybe you brush your teeth and maybe blood start coming out. You have an inflamed gum that won't go easily. This is a periodontal problem. Then, of course, we have gingivitis. It's an inflammation. This inflammation sometimes can be caused by replaced denture or because of one other periodontal problem or the other. If you look at first, this slide is identified different problems that can occur in the mouth that can lead to teeth loss. And again, other problems that will also occur in the mouth. Let's go further. Now, the problem of periodontitis can be categorized into two. That is, the dental caries and periodontal diseases can be categorized into two, but the causes are many. Sorry, I put 4 causes there. There are more causes, but they are divided into 2 main causes: modifiable, and the other is non-modifiable. Modifiable problem and non-modifiable problem that can occur, that can lead to dental caries and periodontal diseases. Now, you will see there, I have listed some of them, and I place in front of them modifiable or non-modifiable. Now, the modifiable problems are the ones I listed first. Like I told you, bacterial infections, attack on the gum, attack on the teeth, causing dental caries and plaque and so on and so forth. These are modifiable dental problems. Then somebody who smokes continuously, that is a modifiable. Modifiable problems are factors that can be controlled. These are factors periodontal that cause periodontal and dental caries that can be controlled. So somebody can control attack by bacteria. You can control attack due to tobacco smoking. Of course, if you stop smoking, that will end. Then diabetes. For people who are diabetic, that is blood sugar, those want to they are liable to having dental caries or worsening dental diseases. Then again, those who have cardiovascular diseases, hypertension, and so on and so forth. Those who are overstressed, who stress themselves. Stress is associated with dental caries and periodontal disease. These are findings that have been confirmed by research and has been acknowledged by professionals around the world. And these are modifiable factors that can cause dental caries and periodontal diseases. They can make it worse if someone already has them. But non-modifiable diseases are osteoporosis. Osteoporosis has to do with bone problem, when there's loss of bone. And this can happen for a lot of factors. When there's a loss of bone in human body, maybe due to deficiencies of the minerals that support the growth of bone, let's say calcium, like phosphorus. This osteoporosis can happen, and this can cause serious problem, periodontal problem, and dental caries. Then we have hormonal problem, usually with female. When a female has hormonal problem, that can result and aggravate dental caries and periodontal diseases. These are non-modifiable diseases that cannot be controlled. Then pregnancy can cause this problem as well. There's association between pregnancy and dental caries and periodontal problem. Then other factors can be age. Age, somebody is old, of course, you know, he will have a lot of problem with his teeth. Then the body is getting weaker and is losing its strength. Sex too, we know female, we just talk about hormonal problem and pregnancy now. These are problems that are peculiar to female. Of course, it will not be peculiar to men because men don't get pregnant and they don't have hormonal problem. So education too, somebody who is well educated, of course, will take care of his teeth, will be aware of oral problem, and definitely we want to attend to it and know how to attend to it. Then we have problem of genetics, so many other problems that can be associated with dental caries and periodontal problem. These are problems that happen to patients. And as a dental professional, I mean, community health professional, you should be familiar with all these problems. In the course of this lecture, you will see how to identify some of these in the mouth. I've shown you some slides which will show you some of them. This is an example of one of them. This is calculus. Some people have calculus. You can see how it looks. You can see how thin the teeth are, the gum area. You can see this side, the yellowish, that is a plaque, and the tartar. It has gotten stuck to the teeth. It has inflamed the gum. It's already causing damage to the gum. It's already attacking the teeth. The bacteria are working there. And as a matter of fact, within a short time, all those teeth will lose their position in the alveolar ridge and they will be lost. That is why education is important. Some people have this problem. They don't know how to go about it, and as a result of which it aggravated and the teeth are lost. So these are problems that are caused by dental caries, the plaque, and so on and so forth. Then if you are asked, what is the difference between plaque and calculus? Plaque is a sticky, colorless film that constantly form on your teeth. The bacteria will hide there. The dental plaque, we talked about it before now. They will secrete acid. They will cause tooth decay. They will attack the gum. There will be gum reception. There will be inflammation. There will be pain. There will be periodontal problem. And eventually that tooth may be lost. But they can be dealt with if you constantly visit your dental clinic, you constantly wash your teeth, you do your flossing, you use the right method of brushing, you use flossing to floss your teeth, and so on and so forth. All this will help you to remove plaque and calculus from your mouth. So calculus may not easily be removed anyway, but until you get to the clinic. And the dental therapists help you to remove it. And they have special instruments that they can use to remove calculus. Calculus is harder, is stronger. Before the individual who wants to remove them could also remove them, especially when they are thick and they've been there for a while. You will also know that that individual has really spent a lot of energy to be able to remove calculus. These are problems that do occur in the mouth. If you see the patient mouth where you see that color, you see some kind of material around the teeth, that is calculus. The best thing is to advise the patient on good oral hygiene, and the patient should also go quickly to a dental clinic to have all this removed and maintain good oral hygiene. Once you are able to do this for a patient, you are able to do him a world of good, because artificial teeth are there, they're fine, and they can do a lot of job. They cannot replace natural teeth. What I meant by that is that natural teeth will continue to serve you better, will continue to do the job better. So it's better an individual maintains good oral hygiene and retain his natural teeth than lose them. So these are the messages you pass across to your patient so that they will continually make sure they do the right thing with their mouth. Okay. Still talking about poor oral hygiene, what the consequences can be. You can see in the first slide on data queries, you can see holes. Some of our students may even have holes there. So they visit dental clinic and get the hole filled. So holes are there, and this hole, no doubt, continue to admit food particles and cause serious pains for patients. So it's very important you don't let this hole develop by ensuring that you maintain good oral hygiene. You can see the periodontal problem causing different colors in the mouth and causing inflammation of the gum. They can be so painful, no doubt. So it's very important a good oral hygiene is maintained. As a community health worker, you need to intimate your patients, the members of the community, with the need for them to maintain good oral hygiene. And for you to be able to identify what problems are, when you see their mouth and all that, you know that this one is in grave danger. He needs to visit the clinic, and you refer them to a clinic immediately so that they can be treated. Okay, now these are stages of periodontal disease. I'm showing you this so that once you see one, you'll be able to advise the patient appropriately. These are stages of periodontal diseases. Now, at the extreme left in your screen, you see a healthy gum. The healthy gum has the gums firmly around the tooth and is pinkish in color. Any color that is not pink or dark depends on the color of the gum of the patient. Once as you notice it, you will know that this mouth or this tooth or this teeth are having problems. And that is at that initial time, a patient is advised on how to maintain good oral hygiene. But then when it is now getting to a point that the point of gingivitis, what you notice at that time is the gum become reddish and it swells and bleeds. At slightest brushing, you see blood come out. At that time, you know that gingivitis is setting in. And if you meet a patient, best thing for you is to tell the patient to quickly seek dental treatment advice. Dental treatment in a clinic. But you can help the patient to make sure you educate him on how to maintain good oral hygiene and those things he has to do, like cleaning, like flossing, so that the gingivitis will not get to advanced stage. Then mild periodontitis, this can result to bone loss. You can see, if you see around that tooth, you see the exchange of color. That is periodontal problem. It results in bone loss. In gingivitis stage, you notice that the bone is getting problem, but it has not really shown well. But at my periodontitis stage, you see pronounced problem with the bone. At this stage, this patient should go to the dental clinic, and you see the gum become more reddish. It's now inflamed. The redness of the gum around the teeth show that this patient is in grave danger. Then moderate periodontitis, of course, the redness of the bone is there, of the gum is there, and the bone loss is getting more. The bone destruction is getting more at this stage. Once you know that the gum around the teeth of a patient is getting too reddish, then you quickly advise him or her to go to the dental clinic. At a point where periodontitis has become so severe, of course, at that time, almost all the bone is lost, and at this stage, the bone might be, the tooth might be recommended for extraction. So it's very important that you don't let patients to get to this level before they get help. Now, these are dental problems that have been identified according to research. These are dental problems that have been identified, and there are different consequences. Of course, caries, which I told you, it will cause hole in the mouth of the patient. The calculus will lead to bone loss, and you cannot remove calculus when you get to the dental clinic. The gingivitis that causes redness of the gum around the tooth. Then the periodontitis also causes the same thing, but the gum will be so inflamed and very reddish. Then another bad problem with dental problem is bad breath. People have bad oral dentition, the mouth is bad. If he breathes, if he talks, you see that people can perceive offensive odor coming out of his mouth. Then another one is what is called sensitive teeth. Where I told you before that when somebody, for example, in Buddhism, when he continuously grinds his teeth, it will remove the top layer, the enamel. Then when it gets to the dental, then the teeth becomes sensitive. And at that point, it's very, very, very bad. Very, very bad. The dental clinic, dental professionals must have to step in. These are dental problems that are associated with the teeth and the gum in the mouth. Now, so many problems that research has shown us, according to British Dental Health Foundation, that can arise as a result of poor dental health. It can cause stroke, heart disease, mouth cancer, diabetes, gum disease. It can cause someone to lose his teeth. Like I just said previously, bad breath. Somebody talks, offensive odor comes out of his mouth. Tooth decay, having hole in the mouth and causing the damage to the crown and eventually removal. It can cause lung diseases. Lung is part of the body that takes the air that we breathe. So you see, there's a lot of connection between dental diseases and other popular diseases that are known these days. And that is why oral health is very important. And as a community health professional, you need to identify them early enough so that you can educate your patient, educate members of the community, hold constant oral health discussion, try to help them to understand the dangers. Now you know the dangers can cause stroke, it can cause heart disease, it can cause lung problem, can cause bad breath, loss of teeth, and so on. So for that reason, early identification of oral problem is very important. And that is why you're there to make sure the patient and members of the community who may not have direct access to dental care to quickly identify the problem at the initial stages, and solve the problem. Okay. Let me conclude this way. At the community health level, primary oral health care practitioners must understand the imperativeness of oral care, as most dwellers cannot access hospitals where dental services are available. I'm happy this lecture has helped you to understand this, to be able to identify some of these problems, their consequences. And this basic knowledge that this lecture has conferred on you will help you to help members of the community, local community, to understand what is meant by dental problem and to attend to them early enough so that it doesn't cause problem for them. I hope I'm able to deal with this subject matter, and I will expect from you questions so that we can begin to interact on the lecture. So students, here we are, haven't dealt with oral diseases and care, and having identified some of them, I believe you will be able to identify one where there's problem. Now somebody raised her hand up. I can only attend to you now. I tell A32F, I don't know your name, but if you are the one, I will open your mic now so that you can speak. Yeah, I will release your mic so that you speak. Or let me release the mic of everybody. Let me release the mic of everybody so that I can speak. I don't expect anybody to, please, not to make a noise. Okay, you can speak now. Please, if you don't have anything to say, just kindly spare us this time and not make any noise. Please, you raise your hand. I tell, oh, she has left. He or she has left the class. But if you have questions, please do not hesitate to ask. If you have questions, please don't hesitate to ask. You can speak now and everybody can hear you. Okay, go ahead. Afolabi Fatima Malara.
Sir, you said when the adults lost tooth or teeth rather, sir, that the dentist cannot return the old 32 teeth, but you said they can only return like 28. So, sir, what is the causes for not being able to return the old 32 teeth, sir? That's my question, sir.
Okay, I got your question, and I believe everybody is hearing you too. Now, 32 teeth are the total number of permanent teeth that a full adult will grow. And when we are replacing, we don't replace the wisdom teeth, because the wisdom teeth is at the last end of the arch. And usually experience have shown that if they are replaced, they cause what you call temporal mandibular problem. Temporal mandibular problem is the joint, the point at which the lower jaw joins with the head. You will know that human head, no part of the human head moves except the lower jaw. It's only your lower jaw that is moving. Your upper jaw is not moving. When you are talking, when you are eating, whatever you are doing, it's only the lower jaw that is moving. The lower jaw is connected to the skull by a joint called temporal mandibular joint. Now, once you replace up to the second molar, the third molar, if you replace it, is going to cause some kind of pains. It's going to cause a problem of occlusion. So for that reason, they are not usually replaced. We rather replace first molar and second molar. We don't replace the third molar. And besides, if you have first to second molar, you can still continue your normal life without, with chewing and biting. You can continue without problem. So if the third molar is not replaced, that is not a problem. You can continue your normal life with the rest of the teeth. So I hope that answers your question.
Yes, sir. Yes, sir. Thank you, sir.
Okay. Now, any other question, please? Let's make the class interactive. Anyone has questions should please indicate, and we release his or her mic so that the rest of us can hear the question and get an answer as well. Okay. Gentle ladies, because there are no men here. Ladies, I think if you don't have question, we can as well call it a day. Sulaiman, Rufia, do you want to ask a question?
No, sir.
Okay. I hope the lecture is interesting and it's understood. Is there any area you find difficult to understand and you can draw my attention to?
Yes, sir.
Yeah, I'm listening.
No, sir.
Okay. Everything is understood.
Yes, sir.
So if we say the question today, you'll be able to understand and do the question and perform excellently.
Yes, sir.
Oh, that is great. I am made today. Okay, so everyone, thank you for coming. I will let you know again when lecture comes up. So enjoy the day and have the best of the time.
All
So
right,
bye-bye.
Thank you, sir.
Yeah, bye.
Bye.
Yeah.